Hello, my name is Nima. I'm a dermatologist in Los Angeles. For those of you who don't know me, I'm also Director of Mohs Micrographic Surgery for the Department of Dermatology at Cedars-Sinai Medical Center. In this presentation, I'll be going over the bodyFX device. Some of you have already used this device. Some of you definitely have seen it used. The purpose is mainly to go over data from a recent study that we published in LSM, where we showed a reduction in body weight, fat content, fat weight, and also showed a decrease in adipose cells, an increase in adipose cell apoptosis, as well as an increase in new collagen formation. This bodyFX device is the only non-invasive body contouring device proven in a peer-reviewed human study to both permanently kill adipose tissue and tighten the skin. There's a separate study performed by Dr. Mulholland which discusses the effect of bodyFX on cellulite, and that's a subject of a different presentation. So this is what the bodyFX device, as you know, looks like. It's got a nice ergonomic feature, easy to hold, can be performed, on the patient with or without the use of an assistant. The way the bodyFX works is it utilizes a suction-coupled bipolar RF configuration, and it has a built-in infrared skin surface temperature sensor. So there's a vacuum which draws up the tissue between the bipolar RF electrodes, and this facilitates a deep dermal and fat layer treatment. And it also leads to even heating of the skin and adipose tissue to a uniform depth of approximately 2.5 centimeters. The device, while it's working, it measures skin temperature, impedance, and it measures epidermal contact 10 times per second, allowing for real-time feedback and a uniform, safe treatment. It also deploys a software algorithm that immediately, automatically, and temporarily eliminates the delivery of RF energy to the area once the pre-selected cutoff temperature is reached. So once the temperature of a treatment area drops to even 0.1 degrees Celsius below the set target temperature, or as the physician moves the temperature applicator, the treatment applicator, over a new area that hasn't reached this predetermined temperature, the device then automatically reactivates the RF energy. So the mechanism by which this device works is through irreversible electroporation. So it uses high voltage, ultra short pulse duration RF pulses. They're very rapid pulses that selectively target the cell membrane of adipocytes, and this results in an irreversible electroporation effect. This irreversible electroporation disrupts the continuity of the adipocyte cell membrane. It hinders its ability to regulate cell homeostasis. And once the continuity of this cell membrane, pretty much any cell, and in this case the adipocyte, is irreversibly disrupted, this starts a cascade of apoptosis, ultimately resulting in permanent programmed cell death of the adipocytes. What's nice about adipocytes is that they have high tissue resistance, which allows them to generate significant heat when RF energy is passed through the tissue. Additionally, adipocytes are also designed in a way where they have relatively low heat transfer coefficients, which means they don't transmit significant amounts of heat to unintended surrounding tissues and surrounding structures. They're very well insulated in a manner. And as a result of these characteristics, RF energy can be used to generate substantial heating of the adipocytes while limiting the spread of this heat to surrounding structures, resulting in a localized effect. The study that we're going to talk about is a study that was published in 2014 in LSM. Myself, Dr. Nelson, and Dr. Lask are co-authors on the study. And just to kind of go over some of the parameters of the study. In this study, 21 subjects underwent treatment of their abdominal fat once weekly for 6 weeks. The clinical outcomes that we measured included abdominal circumference, adipose tissue thickness as measured by ultrasound, adipose tissue weight, body weight, and then we also have clinical photographs which showed a significant effect of the treatments. Adverse events were also recorded, and then 3 patients in the study who were undergoing a future elective abdominoplasty were also treated with the same protocol, once weekly for 6 weeks, but only on one side of their abdomen before abdominoplasty. And then biopsies from the RF-treated side and the untreated sides were harvested during abdominoplasty and cultured, and we performed histologic studies as well as immunohistochemistry looking at adipocyte size and shape, the rate of apoptosis, as well as collagen production and the dermal thickness. So this is an example of what a patient looks like immediately after treatment, in a separate video, I'm going to send you a video of a patient that I've treated with the bodyFX device, so you can see, the overlap that we use when we treat these patients, and also how tolerable it is in terms of treatment. As for the study that we've done, that we did in LSM, the parameters were as follows. So, on the device, you have the RF power that has to be set, and also the cutoff temperature. And in our study, we set the power at 40 watts and the temperature at 42 degrees Celsius. You also have to designate how low or high you want the pulse duration to be, and in our study, the pulse duration was set at 3 to 3.5 seconds. The surface of the abdomen was then divided into 2 zones, or right side and the left side, with each zone being approximately the size of 6 to 8 vacuum chambers. And then the treatments were performed by applying the device applicator for the entire pulse duration, that is 3 to 3.5 seconds. The device turns itself off after the pulse duration is complete, and then moving to a surrounding tissue or adjacent tissue immediately, with an overlap of approximately 20%. Each zone was treated in a clockwise fashion until the zone reached the cutoff temperature of 42 degrees. And then once the cutoff temperature was attained, which usually took about 60 seconds, this then led to the second RF being automatically emitted, and the cutoff temperature was maintained in these treatment zones for 5 minutes, with a minimum of 10 passes of the high voltage second RF pulses, so resulting in 5 minutes of high amplitude RF pulse treatments. The process was then repeated on the other side of the abdomen, and then once both sides were treated, a second treatment pass through each side was then performed. And then, as I mentioned, 3 of our abdominoplasty subjects were only treated on one side. So if you look at the data, here we have a table where we're looking at abdominal circumference, fat tissue thickness, fat tissue weight, and body weight. Let's start with body weight. So this is, it's divided into 4 categories: before treatment, immediately after the 6 sessions, the 6 weekly sessions were completed, at a 1-month follow-up, and at a 3-month follow-up. So if you look at body weight, as I mentioned initially, we did see a significant decrease in body weight after the immediately after the 6-week treatment, the 6-week protocol. But at 1-month follow-up, the body weight seemed to go back up to what it was at pre-treatment levels, and at 3 months, it was no longer statistically significant. However, when we looked at other parameters like fat tissue weight, we saw that the fat tissue weight went from a 32.2 kilogram plus or minus 8.9 to a statistically significant number of 31.2 immediately after the 6-week protocol, and it was maintained at 1 month at 30.8 and at 3 months at 30.7. When we looked at fat tissue thickness using ultrasound, we also saw that the thickness is measured in millimeters decreased before treatment and to, from 40.5 plus or minus 11.4 to a statistically significant number of 38.5 millimeters plus or minus 11 millimeters at 1-month follow-up. And then abdominal circumference was also measured in these 21 patients. Again, we saw a number that was statistically significant from 113.4 to 111.5 immediately after the protocol, and this was maintained at 1 month, and it was maintained at 3 months. This is one example of one of our patients where we looked at the effect of bodyFX using ultrasound on the fat tissue thickness. At baseline, this patient had 37 millimeters of fat tissue thickness, and at the 1 month follow-up, following the treatment protocol, the thickness of the fat was maintained and decreased to 31, which is pretty significant. Just to show you some of the data from the 3 abdominoplasty patients that we treated. So again, here, these patients were already going elective abdominoplasties. They were treated on one side, and the data that we're showing here, with there's 4 histologic sections here, A and C, which show it's baseline basically, which is the side that was not treated with the bodyFX, versus the treated sides, which are slide photos B and D. Again, you can note that here the adipocytes have a nice plump appearance, whereas here they have more of a feathery appearance, again demonstrating the effect of the device on apoptosis. There's also a marker of apoptosis called APAF1, which is pretty specific for apoptotic adipocytes. And what we found is when we stained for this in the untreated versus the treated sides, we saw a 30% increase in the expression of this marker, noting corresponding to a 30% increase. And then the last thing that we showed in this study was looking at the dermis and looking at collagen synthesis. And what we found is that in patients who were on the treated side, the dermis actually became more compact, and also the expression of collagen was increased to approximately 13.7% more collagen. So we were seeing a decrease not only in the amount of fat within the regions that were treated, but also an increase in fat apoptosis on the side that was treated, and an increase in collagen with a more tight, more compact dermis. Here are some clinical photographs. Again, these are showing the untreated side, which is on the left, as shown here, and this is the treated side. And these are photographs that are at 3 months following the completion of the protocol, showing maintenance of clinical improvements. Again, this is another patient from a different angle. So in summary, the purpose of this study was to show the efficacy of the device on fat. 21 subjects underwent 1 treatment weekly for 6 weeks, and some of the results that we showed that were significant. At 1 month, in one of our patients, we showed that using echo or ultrasound, we showed clinical improvements, showing a reduction from 37 to 31 millimeters in subcutaneous fat layer tissue thickness, and this was consistent across the board with our other patients. This happened to be the most significant, a 6 millimeter decrease, but in some of the other patients, we still saw a statistically significant reduction. At 3 months, we also showed that the average abdominal circumference decreased further to 110.7 from about 113.4, a total reduction of 2.7 centimeters from baseline. We showed that 20% of all adipocyte cells stained positive for APAF1, a validated marker of apoptosis, and when these cells were actually maintained in culture, fat apop, which is sort of an ex vivo model, and it represents what happens in vivo as well. What we saw is that fat cell apoptosis had further increased, and that 30% of the adipocytes stained positive for APAF1. And then the last thing we showed was that there was a significant increase in collagen synthesis, representing an average increase of about 13.7%. I hope this presentation helped in answering any questions that you had about the study, and just kind of going over some of the parameters that we used in the study. And if you have any questions, I'm more than happy to answer them. You can certainly reach me by phone or via email. Thank you very much.